My name is Tomas Magana. I am a pediatrician at Children's Hospital Oakland, and I've been given the honor of welcoming you all tonight at this lovely event. I was one of several healthcare professionals that went down to Cuba a few weeks ago and experienced one of the most transformative experiences of my life. The event is the result of a 3-year project which has been initiated by the MEDICC organization. I hope you're all familiar with this. MEDICC stands for Medical Education Cooperation with Cuba, and they are based here in Oakland. Over this past 3-year period, members of various healthcare representations here in Oakland have traveled to Cuba on 3 different occasions where we really went to explore what the healthcare issues were and how the healthcare system addressed these. The idea being is that we wanted to take the lessons learned to bring them back to Oakland so that we can improve the health status of communities locally. The organizations that have been involved are up there, and you can see that it represents a number of different sectors, and individuals from each organization have actually gone to Cuba.
This is one of those times where it was one of the most exciting experiences I have had in my professional career, but also one of the most unsettling experiences I've had of my entire career, because I began to realize how much was being accomplished in a country that at times we have utter disdain for, but how much better they were doing something that I was supposed to be doing, and that's running a health system, how much better they were doing at it, and how much better their population was being treated within their health system.
So back in November of 2007, we started to meet with representatives of each of the organizations that were initially involved in this project. Over the following 3 years, there were then 3 trips. And on each trip, it was about 15 people that got to attend, again, representatives from each of the organizations. We would visit clinics, we would visit hospitals, we got to visit schools, community groups, and again, our goal was to absorb as much as we could and ask as many questions as we could.
One of the things that we saw when we were there was a public health system, a complete system. It wasn't the clinics here, the health department here, environmental health over here. It was all together. One of the pieces of this project is a component called, and I think I can pronounce it now, dispensarización. All right. Which is a way of using data and risk stratification for the residents and health planning. And we think we can try it and see, how does this work? Can we do this in a very seamless way so that the residents don't feel it, so that it doesn't look fragmented? So maybe a year from now, we'll be able to come back and say, okay, we're doing it. It's working.
We've accepted locally the challenge of trying to learn from the Cuba experience and apply it locally. So our new model, or the model we intend to pilot beginning in January this year, is this same, and basically I'd like to call it, can we call it a polyclinic or a consultorio? So in the next 18 to 24 months, we'll be opening 11 new school-based health centers, 9 in Oakland alone. We intend to pilot 4 fire station-based clinics, and we have 2 faith-based clinics, 1 in operation and 1 in design and development in East Oakland. So in terms of accepting the challenge to redesign our local health system in terms of the best practices of what we perceive as a more just and equitable system, we accept that challenge. Thank you.
We'll share a story with you that continues to impact me today. The story is we were in a community transformation workshop. I think the 3rd or 4th day we're in Cuba. And while our meeting was going on, a couple of us noticed that our interpreter was starting to scratch her arms and getting these sort of red welts on her arm. This was just after lunch. She had eaten seafood and was beginning to experience a seafood allergy. And so Diane got up and attended to her, and then the next thing we noticed, they were walking out of the building we were in. And so we continued our meeting, and we were all a little bit unsettled. We continued our meeting, and about 25 minutes later, the 2 of them returned, and our interpreter, Yoyi, looked fine. In that time, Yoyi and Diane had walked around the corner to a polyclinic. A polyclinic is not really a clinic. It's this hybrid of ambulatory, primary care, specialty care, some diagnostic services, urgent care, an emergency department, an intensive care unit, and an observation suite, all in one building. And in about 25 minutes, Yo-Yi was screened, assessed, an order was written for IV epinephrine. It was administered in the treatment room. She was monitored briefly, discharged, and she returned back to her meeting. And so I sat and I said to myself, huh. And someone looked at me and said, okay, right, go back and do that at Highland. You know, what's sort of striking there is as Kimmy said, it's a seamless system.
We had initially come together interested in talking about diabetes. We said we want to move upstream, following the Cuban model, and really do prevention and really work with youth. So those were some important decisions we made. On all 3 trips, we had the opportunity to meet with really impressive U.S. students who were receiving a full scholarship to medical school from the Cuban government. And we have done a lot to try to strengthen our support for those students here in Oakland.
In Cuba, we're trained to think about and work within healthcare differently. We're trained to provide high-quality services to large numbers of people with minimal resources. And here at home, with the immense resources that we know are available, the scarcity of services just doesn't seem to add up. And when you tell me that it's not possible to provide high-quality services at low costs, well, I know that that's simply not true. I know that that's not true because not only have I seen it work, but I've done the work.
So it's really important in communities where we have community health partnerships like Oakland that we reach out to ensure that these students that have incredible opportunities, incredible experience, and incredible intellect can have a reasonable path back to the U.S. when they finish their training. You made a comment which I like, which is not only have I seen the work, but I've done it. And so for me, it's not just a selfless act, it's a little bit selfish because I want some of your intellect to be spread amongst our providers and our patients because you have things to teach us.